Hi viewers, I am Dr.Natesh Prabhu. I am a consultant andrologist from Manipal Fertility Group, and today we are having a most I think like it's a first in India and probably first in the world. We are having a couple like who has got, I mean the husband has got a penile implant surgery, and we are going to hear from them about the story. Hello, hello sir. Hello madam.
Hi.
Sorry. Please introduce yourself.
Yeah. My name is Sarvesh Biyani. Basically, I'm from Rajasthan, now based at Surat. By professional, I am a textile manufacturer.
Hi, this is Shachi, and I'm a housewife.
So, like, what was the issue? So, yeah, like which you have had before.
Yeah, I was married on 16th Feb 2010. After that, I come to know that I am suffering from erectile dysfunction. That we are not able to make any type of sexual relationship.
So, like, it was, how long was it?
I think after marriage it occurs.
Okay.
Okay.
After marriage.
Yeah.
Fine. Like, how was your mindset? But like when you came to know like this was a problem, like.
I share with her that we are not able to make any type of relationship. So we decided that first we will consult a doctor in Ahmedabad, and we have consulted him. He have given some general medicine that try this type of Viagra tablets, all that that you try. Then I have taken that course for around 10 to 15 days, and he had also done some RG scan at that time.
So basically you have done investigations like which didn't work well for you.
Yeah, well for you. But I have taken medicine for 10 to 15 days, but they are not working for me.
Yeah. I think like mostly the newly married couples like they had some problem by then.
Yeah.
But I think your wife was there with you for all the time, good support for your family.
For that entire 10 years, she has given me very good support.
With the family, your in-laws, your father.
After my marriage, both of us, me and my wife, is on knowing that I am suffering from this problem.
Okay.
Slowly my we told us to my parents that we are suffering. Then she told her father that I was suffering from this type of problem. Then what happened? Her father visited my home. And tell me that do visit and good doctor, search whatever.
So there was a big support for you, know. Both sides like they don't accuse you of a problem. They motivated you to very scientific they were.
Scientific. They both motivated us, and even my father-in-law is very practical. See, I will tell you, he is very practical. He told that इलाज available है, treatment is available. So you should go. So first we have consulted Ahmedabad.
So this was in 2012-11, right?
No. Yeah, it was 2011. That was 2011.
First.
First. So then we have taken in Ahmedabad. Then
University.
So you saw the person. Under the treatment, which could have caused a mental trauma for you. Like, what was there in your mind? Like when you visited a doctor and it didn't work for you, you would have thought, okay, that thing is working for me.
Actually, like the time was very worse because we are not getting what he's dealing with actually.
So there was no proper communication with your doctor and yourself.
There was not a problem. Then we visited another doctor. He told us that we want to do for this treatment. First he have given us injection therapy. There is some injection he injected my penis. He showed that how many hours it will last and whatever. Then he admitted me for 48 hours under observation at a local hospital in Hyderabad, where he tested us that RG scan and some blood test and whatever.
So basically they made a workup and they are like
after that he has given us some medicine again. He told us that try this. First we will try from medicine like Viagra and all that for 10 days. Then if this medicine will not work, then I will see you
Last
again.
option is transplant.
Implant.
Penile
Actually,
implant,
yeah, implant,
sorry.
yes, last one.
Then again we go back to Ahmedabad. Then I have taken that all medicine, but again failure.
It didn't work.
Yeah,
So
yeah, no, nothing will never work. Then I met doctor that sir, this medicine is not working. Then he told, doctor told me, so decide with your family, come to Hyderabad, then we will talk.
Discuss
Then
about that.
me,
Okay.
my wife, my father-in-law, visited doctor. He gives us option that now only option is available is penile implant.
Yeah, penile implant.
Yeah. That because no medicine is working, whatever we have tried, then he told us. Then at that time, he gives a suggestion that 3-piece. I don't
Yeah,
know.
you have done a 3-piece implant.
Yeah, he told us that is a very good penile. 3-piece implant is very good. He told us. Then we go back to Ahmedabad. Then we have decided that we will go for 3-piece
implant.
Yeah, 3-piece implant. I think on 30th April 2000, he operated me.
2012.
I still remember that 30th April 2012, he operated me. Before the implant, I think before 48 hours he had admitted me in hospital. Then he operated on 30th April sharp at 7 a.m. He started my
So you are remembering all.
at a local hospital in Hyderabad, where here doctor implanted like 3-piece implant. That was around 7 a.m. He had taken me OT, and for around 11:30 or something like that, I come back from operation theatre. Then for after my implant 2 to 3 days approx, I was in hospital
Okay.
for local medicines and all that stuff. After 3 days, our discharge papers are done. He told us that this visit our clinic. We are gone there. He tested my implant. Everything was okay.
Okay.
And he told us that go back to Ahmedabad.
Okay.
And after 10 to 15 days, we will come back. When we go back to Ahmedabad after 2 to 3 days, or 2 to 4 days, I think what happened, some type of boils, small boils has formed on my scrotum. Then we informed the doctor told us, no need to worry, you take some powder, antibiotic powder or antibiotic cream he had given us. Then we taken. Then again they are not going. Then doctor told us, please come to Hyderabad. Then again we go back to Hyderabad. He told us, he checked my implant was working properly. Then again he tested probably, this is okay, nothing to worry, you go back. And again we come back to Ahmedabad. What I found is little pus. Pus started pushing out of that
The wall.
yeah.
Okay.
Then we share some photos to doctor. Then doctor gives us a medicine. That time is particular dactomycin. It's a type of injection medicine, and it is a very costly medicine, I think.
Again, like it didn't work for you at all.
No. I have taken around 5 to 8 bottles.
So still the pus was coming out.
Then it started heavily.
So I think we went back.
No. Then he told us that please send me some photos of that area. I have sent some photos of the area. He told me in email that sorry, your implant is infected.
Okay, so we have to go for the.
Yeah. We have to urgently remove it within 72 hours. Then again I put my tears.
No, again you have to reimplant within 72 hours.
No, first we have to remove it and again we have to reimplant in within 72 or within a week. He told us. Then again we go back to Hyderabad.
So again mentally you are ready for the e-surgery.
No. He removed us. He again was the same hospital, same thing. Removed us in within 1
Very
hour.
dramatic for you.
Yeah, very dramatic for me. Then doctor comes for checkup. We asked him what will happen. He told us one thing only. We have to within 7 days or 10 days we have to reimplant it again. Otherwise some type of fibrosis will happen, and in future you will be not able to do reimplant. But we discussed with my family. Family told us, please try second option. And even I was not ready for third surgery.
So they
already 2 done, 3 done.
So you gave the hopes.
Yeah.
So family supported for you.
Yeah, family supported. She supported me very well. she's a very well. Then we both decided last time we will try.
Last time?
Yeah. From last time we will try. Is that then at that time my sister, my cousin brothers were living in Bengaluru at Outer Ring Road. Then my sister informed me. My sister had taken an appointment from Manipal Fertility, Dr.Vasan.
So that time she was looking for someone in Bangalore and she found Dr. Vasan.
Yeah. Actually, she found Dr. Vasan. We take an appointment. We have visited
Manipal Ankur.
Yeah, at
Rajaji Nagar.
Rajaji Nagar. There was a big area. Right side there is Dr.
Metro will be there.
Yeah, Metro will be there. Dr. Vasan cabin. We visited around at the time there was very rush. At the evening we take an appointment 6 p.m. or 6:30 p.m. We have entered his cabin. And the best part was that he had given us 45 minutes on the first day. He take us complete story, what happened, where you are operated, what about doctor, case study. Single line he told us that it is curable. Yeah.
So you got your life back, sort of.
Actually, that 45 minutes. Yeah, we get some moment. That 45 minutes where I was. He take a paper. He draw that this happened, how it infected. There are many problems. Then I personally asked him, sir. He told us, now you have done surgery. You will take 1.5 month rest. Then I told us, sir, I am getting some pressure from Hyderabad that again fibrosis will form, and then I'm not
again being there.
Yeah. Then he told me, Sarvesh, don't worry, everything will be okay. He used some tests like ultrasound, blood test,
basic test before surgery.
Yeah, basic test. We have done it, and the next day give it to doctor. Okay, and after 1.5 months, he gives us date
for surgery.
Yeah.
So now like it's going to be a 2-piece implant for you.
Yeah. He suggested that 2 pieces suitable for you. There were 2 pieces suitable for you. He suggested 2 pieces malleable implant for me. Then after 1.5 months, he
agreed for surgery.
Yeah, agreed for surgery. Then on the day of surgery, he had admitted me on around 5 a.m. in the morning. Early morning, 5 a.m. in the morning. Used some enema for enema, cleaning, and all that stuff. Around 7 a.m. they taken me to
medical surgery.
OT. Giving me local anesthesia, like whatever. And at the time of surgery, even doctor done me semen test.
To make sure like you don't have any issue with fertility.
That's true. At the time he taken some sperm, and at the time of surgery he was talking with me. Everything will be okay. Don't worry.
He was reassuring you.
Yeah. And he was doing surgery and reassuring me. Then around 1.5 hours we have completed all surgery. We are out from OT. After 48 hours.
You got discharged?
Got discharged. 48 hours, after 48 hours discharged. After 48 hours we got discharged. Then after 7 days he called us for normal checkup, stitches and all.
7 days still you were there in Bangalore?
Yeah. In Bengaluru. Then
tourist in Bangalore.
Then he told us everything will be okay. Now you can go back.
So those 7 days, so what was your mentality like? Something like kept
I was feeling very refreshed. 7 days, doctor was
you're feeling confidence in your mind?
Very confident. He told me that everything will be okay, and after 7 days he told me now infection, now there is no risk for infection. So I was on the top of the world at that time.
So you came back to Ahmedabad?
Then 10-15 days we were in Bangalore visiting UBCT and all that, movie, malls. We tried Andhra meals.
But still he remembers everything because you have gone through all those bad stages.
But then again we are going to Bangalore, Ahmedabad. Then we tried that Kathi Road on Bangalore airport, all this stuff. Then we come back to Ahmedabad. After 5 to 7 days, I have started my office work. Then after 1.5 months from my surgery, we first time we had done intercourse. Yeah, it was successful. Then again on 7/7/2014.
We had a
Yeah, first baby boy. His name is Radwan. Then now on 20th March,
2000.
Second baby.
second another baby boy. We had.
So I think for a person like you,
Yeah.
this is a very best option because like you have got back your family, you have got back your kids. Now you have good.
See,
I think people have to come forward for this.
yeah, people have to come forward for this because the thing is that if someone is eating, what will society tell, people, relatives, but it is definitely a curable.
But I think people have to like come out of the shame.
come out of
They don't have to think about the society because society won't give you anything.
Society will not give. See, if he will not come out with shame, what will happen? Divorce will happen, family troubles, family depression. If it is options are available, techniques are available, science is growing.
We are not aware of this techniques actually.
No,
See, we are
Come out, consult a good doctor.
consult a good doctor.
Come out of your shame, and it's curable.
It's curable.
Easy.
See, today I am here. I am a father of because, and I am very thankful to Dr.Vasan. He has changed my life, and he is a real superhero for me. It was a challenge for him to reoperate
On
the third time,
yeah.
to reoperate third time. I think it was one of the difficult or one of the toughest case of his life. Because third time it is not an easy task. Doctor is telling like very coolly, everything will be okay, everything will be okay, don't worry. He was very confident.
So that words helped you a lot.
Yeah. He was very confident, and he has taken my case in priority. See, and when he has taken my case in priority, he has supported us very well. Otherwise, if he will tell, oh, this will happen, fibrosis will form, what will we do, what will we do?
This guy is basically.
Yeah, if he will tell, then what happened?
See, in a very conserved place like India, like you both coming out and just telling about these like these things, I think more patients have to come out.
Yeah, sure.
People actually have to come out of their shame.
What do you want to tell to other family members like housewife who are just stuck up with the societal thing?
No, for this thing you have to come out. You have to forget what society is telling, what people is telling. What you have to consult a best doctor. Actually, you have to consult a doctor. See, it is a curable.
Share your problem.
Share your problem with doctor. I think at that time there are more. Nowadays the science is very.
This was back in 2012.
Yeah, 2012.
And in this 2019, we have advanced so much.
Yeah, you are advanced so much. So we have to come with it. See, what happened if we will feel that society will water, what happened? Divorce will happen, all the stuff, family
Whole life gets turned up.
Yeah, whole life will be
Just thinking about society as things in
society. Yeah. That's the fact.
But your approach is going to be a best example for people. We have seen lot of patients like this who come with this kind of problem, and newly married, non-consummated, and the whole family comes asking us to test whether the boy is fit for the family or not.
See, in my case,
So you are blessed, absolutely. But I want everyone to have the same thing. I want this, to everyone to see this.
But that 2 year, I think 11 to was from Ahmedabad to Hyderabad to Bengaluru. It was a very pathetic time. Very painful, very pathetic time. But
the family structure was good. So it will help you a lot.
No, it's not easy. Again, for third time you are going for surgery, and doctor is smiling and telling everything's
It's
so see, this
it's correctable, yeah.
convince us, it's curable. Because I am getting lot of pressure from Hyderabad that भैया fibrosis form हो जाएगा, surgery नहीं हो पाएगा, ये नहीं हो पाएगा.
It's very actually the conclusion is share your problem. Don't feel shame of this. It's nothing like
Nothing a big
talking
problem.
about sex is like a taboo. It's not a taboo actually. So just come out of your comfort zone. Actually come out of your comfort zone. Consult a good doctor. Share with them, and then have confidence in your doctor. Have some confidence. Actually, the trust is important.
More important, yeah.
More important. Your family support, doctor trusts you, you trust in what doctor is saying, whether he's what he's suggesting me is good for me or not, because I don't know what is 2Ps or what is 3Ps or whether it will going to work third time it will going to work for me or not, or
Assumptions.
if it won't, then something can happen worse
yeah.
with us also. We are not having kids or some
Society will tell
anything.
बच्चे नहीं हुए, ये नहीं हुआ, वो नहीं हुआ.
But it's like science is a miracle, and if you want a miracle to be happen in your life, just be patient.
So
Yeah.
sometime will come.
Yeah. Some 100% it will come.
Yeah, we have even like we have seen patients telling my life was over, I'm going to commit suicide.
No.
We have seen patients like this.
No.
Like I lost my family, I got divorced.
Actually, because I think they won't come out at the right time.
And see,
Again,
The moment the time has passed,
See,
then coming out
they will take this problem as a depression. What will happen? What he will tell? What my friends will tell? What my family member will tell? क्या हुआ, क्या नहीं हुआ? Actually, if you have this type of problem, go to doctor, visit him.
As
That is
early
the
as
most
possible.
prior thing in your life.
as early as possible.
As
early as time.
as it is, and select right doctor at right
It's
place,
not
right time.
like after marriage you realize this thing. Like a boy can realize this thing before marriage also.
So he can go for a premarital test also.
Actually,
He access himself.
If you feel that I come to know that I have something is lacking in me, please consult before your marriage.
And according to me, it's a common problem. It's not any.
It is not a rare at all because we are seeing patients quite often. Only thing is that they are not coming out in public. People are very clandestine. They don't want people to see them.
They don't want people.
Very especially in tier 2 and 3 cities.
Yeah.
I think people have to come out and know that there is like we can assess the problem, we can cure it.
See,
It's a more easily correctable one.
I know that I am a very toughest. I was a very toughest case for Dr.Vasan. I still remember I was
Still after 5 years, like
Yeah.
after 7 years.
Yeah, 7 years. Yeah, 7 years. It changed my life. One way to say, okay, Sarvesh, everything will be fine, everything will be fine. Because if in OT is doing Sarvesh, sab sahi hoga, don't worry, everything will be okay. After 7 days, he told me, no infection, no need to go again.
See, we have seen lot of patients like this, but you are the first person to come out very boldly and address this issue to us. And we hope this is going to make a big impact in the other couple life, other couple's life, so they can come forward. They can see a video.
See,
they can gain a confidence.
See,
Actually, I really want this to happen in India.
Especially in
and even I want to tell you where you want to, because it's a real story. You know everything. But we told us that and Dr.Vasan know everything. Yeah, it's a perfect real story. There is nothing, no mirch, no masala, nothing.
This is Surat,
Yeah.
and we are from Ocean Park apartment.
Yeah,
Ocean
yeah, this is a perfect real story. This is nothing mirch
Nothing
masala.
can get so raw like this.
Yeah, nothing mirch masala. कि ऐसा करा वो हुआ वो नहीं तो only one suggestion to people who come up with your problem, share it with your doctor, and I strongly believe it is 100 150% curable. 150. I'm telling you 150% curability.
I can sense the whole satisfaction.
Actually,
Yeah, it is 150%. 150% curable, not under. It's 150%. If a worst case like me, can you get then other is simply problem like ये नहीं हो रहा वो नहीं हो रहा. It is 150%.
Because we get to see like, I get to see a lot of patients like 28 years, 29 years, getting married, are not able to perform. They come with their family. Sometimes the wife is supportive, sometimes the wife is not supportive. They come until she has gone to her parents' home. Then it's very tough for me to convince to bring her back. If we say we cure the problem, we want his partner to be with him.
actually,
There's no point in only correcting his problem without nobody being with him. That's the
family
main
is always with us, but having a partner with you at that time
It's more important.
more
More
important,
important.
actually.
That is the most important thing.
From
I have seen patients coming, sir, please give me tablets. But where is your wife? My wife is at my in-laws place. Then what's the point in giving that? Convince her, bring her back. Then we will treat the issues.
Yeah, we-
Sometimes the issue will be mostly psychogenic. They can't perform the first time. Mostly psychogenic. Sometimes the issue might be with the female also.
Female also.
So we have to examine both. What gynecologist will be examining the female, the andrologist will be examining the male. So we can come to the issue. Whose problem is that?
yeah, at this place she was with, she was supporting me like anything at every time. Yeah, at a hospital, at the time of surgery, she was sitting outside. Yeah, it's like she was sitting outside the OT. When my implant was removed, I was very depressed. But she was still hoga. But after meeting doctor, then
This is women, Baba.
Actually, it's women power.
yeah. We are meeting with Dr.Vasan for 45 minutes. Then she told me what happened, doctor, what will doctor shows us that every drawing, every technique that now we will do this. Yeah.
Though we are not from the science,
No,
field,
we are
but
not.
still we want
You
to.
understood everything.
No, he told
I
us.
want to. If I am not, I want to. I don't know how, but I want to.
See, even after 2 weeks, I want to work for this for society. For this time. No, even I also told Dr. Vasan that for this purpose I want to work for society. I want to convey my message that what happened with me, what happened.
This is going to be the best example where other people can see this.
Yeah.
They will come forward. They can come forward and get the best out of the current options available to them.
Actually,
See, if we see it's not possible for you. As it is not possible for you that you will within 24 years you will. We have to give some time for. We have to give some
like a
time.
surgery, you have to give some time.
Some time we have to give. You are not a god. No, technical.
True.
So, but if I will tell you कि ये हो गया वो हो गया, you are not a god. That's the thing is, but it is curable. Male infertility, whatever, it is curable. 150% curable. There is no divorce चाहिए ये चाहिए no.
Okay,
Very
message
good.
I want to convey to the couples and so the ladies, I want to convey a message even for male person. You are marrying, two persons are marrying. It's not like we are marriage is for sex. It's not like that. Or for kids, after 2 years we'll have a kid and the family will enjoy this. Love is very important. If you are having love, automatically trust and respect will come out. Whether it's for your wife, it's for your spouse or for anyone, it's a friend or anyone. So important is love. If the worst case is your case won't work in anything, like with the medication, you are not working with the medications, or even the doctor says implant is not working for you or something worse yet happened to you. Love is important. Be with your partner. That's more important, because having a kid is really a very good feeling on top of the world, which I am having right now. I am experiencing, but it's not the only thing in the life. That अगर हमारे बच्चे हो जाएंगे, then we are okay. अगर हमारे बच्चे नहीं होते हैं,
Still you are fine with that.
still we are fine with that.
think people have to come at the problem mentality like this.
Yeah, actually,
Maybe the couples are fine. Again, the in-laws, the parents, those
See, my in-laws,
couple will convince each and every person.
see my
If you are
in-laws.
not happy with me, I don't have any problem. My husband is happy with me, or he says my wife is happy with me, I don't want anyone. For how long? Parents
Yeah.
won't talk with you. For how long? Then finally they will talk with you.
See, my in-laws supported me, even my father-in-law, my father, in my family. Many people know what is problem. But no, everything is okay. Everything is in normal routine. Enjoying my family life. इसलिए ये मैं कहना चाहता हूँ कि इस प्रॉब्लम से मतलब कि कुछ डरने की, कुछ घबराने की, कोई भी सोसाइटी से पूछने की जरूरत नहीं है, क्योंकि सोसाइटी कभी भी अपने काम नहीं आएगी। जब अपने खुद की तकलीफ में होंगे तो सोसाइटी वाला कोई भी नहीं पूछने आएगा, वो बल्कि मजे ही लेगा। फैक्ट। तो इसका अपने को कुछ करने की जरूरत नहीं है। बाकी इट इज क्यूरेबल 100%, नॉट इट्स 150%, 200% क्यूरेबल। विजिट राइट डॉक्टर, right place, right time, and I am very grateful to Dr. Vasan. He really has changed my life. That's
So thank you for being with us.
yeah.
And we hope now, we are pretty sure that this is going to be one of the most important video which we have taken till now.
Thank you.
Thank you.